Okay. This is the trick. Saya tak nak benda ni pun. You just present, open your window, macam as if in exam.
Okay.
This is clinical teaching tau, bukan presentation whatsoever. And then buka your video, kita akan buat, cumanya kita buat secara online je because of the COVID kind of that thing. So I thought that perhaps orang lain yang kena quarantine whatsoever boleh join lah. Okay, buka your video and then kita akan treat this as if you are in exam for final year. Boleh,
Okay.
Alif?
Boleh.
You were given half an hour untuk exam punya time. Maksudnya, presenting termasuklah question and answer. Kita tengok macam mana how is your performance. Kita testing. So, tak payah share. Later on, the other member of the group, kita akan tanyalah. So that is macam mana kita nak buat lah. Sorry lah. I memang nak. I tak suka online. I suka face to face.
Okay.
Okay, Alif. Okay. Now, boleh nak start? Alif, you ready?
Okay, bro.
Okay, kita akan start timing for 30 minutes. 30 minutes ni including question and answer. As if in your exam lah. Boleh? Sudah join timer. Okay, example you ada 1 jam with patient and setengah jam with examiner. So, kita akan treat this as examiner. So, yang lain akan tengok. Adakah you akan reassess your performance later on. That's why tak nak sharing sebenarnya. Okay. Ini sebabnya kita nak clinical teaching adalah clinical, at the end of the day adalah clinical examination. Apa yang kita akan assess pada examination, ni contoh ni mock lah, kira macam mock, adalah your understanding about the cases, how you able to make a diagnosis, and then also your presentation skill lah. So macam mana you tengok presentation skill. Ni timer saya ni. Setengah jam. Orang lain semua okey? You dapat your booster tak? Ada dapat booster tak?
Belum. Esok
Belum.
Semua belum?
saya esok.
Okay, now. Kita start now. Okay, Alif, can you present your case?
Okay, for patient identification, patient is ID 18 years old, Malay male.
Boleh tutup? Tak apalah. Present je.
Tutup apa?
Kalau tutup you punya note nanti tak ingat pula. Tak apa. Continue.
Betul lah. Malay male and he lived in the Kampung Maligai, Melur, and he was a trading student. So for chief complaint, patient is came into the psychiatric clinic with a presentation of market fear and excessive sweating associating with the palpitations. So for history of pulmonary illness, patient is apparently well until he had excessive sweating in his palm and feet.
Chief complaint is what?
Chief complaint is patient came into the psychiatric clinic with the presentation of market fear and excessive sweating association with the palpitations.
For how long?
For 10 months.
Okay.
So for the history of presenting illness, patient was apparently well that he had the excessive sweating in his palm and his feet, which is noticed by his mother in the January 2021. The sweating come naturally and there was no specific event that was make it worse. He was later brought to HUSM by his mother in the August and he had several investigations done and the result was
When was brought to USM?
yes,
When he was brought to USM?
in August.
In August. So meaning that for the past 8 weeks, for the past 8 months.
Yes.
Okay.
And then he had done several investigations and the result was unremarkable. Later, he was referred to the psychiatric clinics for the further management.
How long is the investigation being done before he landed to psychiatric clinic?
For right now, he just landed to psychiatric clinic, so at least 2 months.
Since when?
Since
2 months ago. Since?
2 months ago.
Mm-hmm. Okay.
So 2 months ago, he was do some investigation, and then just right now, he just referred to psychiatric clinics.
Mm-hmm.
So I continue.
Mm.
Then he had a marked fear in the social situations since August 2021, in which he was meeting with unfamiliar people and presenting in the online class. He often anxious in the public place, which make him palpitation to stay in the crowded places, which is like queuing and eating in the publics. In his Friday prayers, when he perform his Friday prayer, he will leave early after the praying, and he will also like to avoid the public places and stay into the uncrowded area. And when he is in the online classes and the lecturer asks the question, will avoid the answer the question. And when the lecturer is angry with him, he will still keep his quiet. And he also rarely open his camera for his online classes.
Macam you all lah ni, most of the student. Okay, then?
Okay, he also claimed that he afraid of being judged because he afraid of being judged by people surround him about his look, personality, and behavior. And it also make him difficult to focus on the class and to do tasks, especially tasks which involve teamwork. So, moreover, he also had difficulty to sleep since early 2020. It was once a week, and usually he sleep at 12 a.m. and wake up at 6:30. But however, nowadays he usually sleep at 1 and 2 and wake up at 6:30. And usually he will listen to a song to help him sleep. And he also easily annoyed with people around him. For example, he will be annoyed when people use his belonging without his permissions, making unnecessary noise and taking care of his personal matter. Otherwise, he had no dizziness, muscle tension, chest pain, fear of dying, shortness of breath, excessive worry about his appearance, no fleeting anxiety, no substance abuse, and no history of medical conditions. Prof, that for HOPI.
Continue.
Okay, for the past psychiatric and medical history, patient had no history of the medical illness and the psychiatric illness. And for drug history, he has no history of the drug use and no traditional medicine use. And also he had no drugs allergy. For the systemic review, it was unremarkable. And for the family history, patient was 4 out of the 5 siblings. And his parent had already divorced. And his father had already passed away from a lung disease. And his mother already had a new husband, and his husband is of the hartanah worker. And patients claim that he had 3 brothers and 1 sister. His brother is working as automobile students and study in the UiTM Perlis, and his younger brother study in the Bachok. He said that he's not close relationship with his family except with his mother and his younger brother, but he never tell his personal problem to them, and his parenting style is permissive. So for the past personal history, patient was born spontaneous vaginal delivery in the HUKM. He had normal developmental milestones. For the middle childhood, parent was divorced when he was 6. and he went to Delhi primary school and changed to other schools, but he cannot remember the reason, and he cannot also recall the school's name. In the standard 3, he also started to move out to Kelantan as his family decided to move here, and he was the introvert student and he had no best friend. He loved to play football and he was once a football athlete in the primary school, and he also prefects in the UPSR. He achieved 3A and 2Bs, and his father, which is the divorced father, is passed away at the age when he aged at 12 years old. So for the late childhood, which is in the primary school, he went to SMK Kubang Krian 3, and he loved to usually play mobile and computer games at home. In the late childhood, he also do not have his best friend and does not sharing his problem with anybody. And when he was 16, he had a girlfriend, and he had the breakup in the same year, but he doesn't tell the reasons why. He loves subject like Bahasa Melayu and English, and he also become a prefect again at 16 and 17. And for the SPM, he get 3B, 1C, 2D, 1E, and 1G. So for the adulthood, he continued his study in the UiTM Machang in the trading business, and he never went to campus and only had the online classes. For the social history, he lived with his parents with 4 siblings in a single-story house with well-equipped and with all basic amenities. The family is moderately stable, and he was not alcoholic and non-smoker. So for the pre-morbid personality, he described himself as introvert. For the habit, he ate normal adult diet and sleep for 8 hours per day. For attitude, he is kind person and willing to help others. And his attitude was a good general toward others. And in relationship, he was not close with his family member. He never shared his problem with his family member. Besides, he only had some close friend who he hang out during his leisure time. In religion, he is a Muslim and perform 5 prayer a day and fast in the Ramadan. And mood, he always in a stable mood, but he was easily annoyed with someone. And for social, he rarely involved in social activities, and the only social activity that he usually involved is the playing football or in and praying in the Fridays for Friday prayers. So for the mental state examinations, for general appearance and behavior, patient is teenager dressed in black attire with cap and pair of slippers. He was well groomed, looking neat and tidy with a good hygiene. He was sitting uncomfortably on chair as he looked anxious. He was cooperative but was unable to maintain good eye contact throughout the interview, and there was no disorganized movement and disorganized behavior. For speech, he speaks fluent Malay language. His speech is coherent and relevant, but the amount of speech is minimal and minimal. However, the speed tone and the volume was normal. For the mood, her mood was stable. The effects of the euthymic and he had the appropriateness were appropriate, and the thought was brought in range. For the perceptual disturbance, he denied having any hallucinations and illusion, nor depersonalization and derealizations. In the thinking disorder, he had a meaningful and understandable form of thought, no formal thought disorder. For the flow, he had normal productivity and continuity of speech and no thought block. For the contents, he had no delusion over value ideas and preoccupied thought. For the possession, he had no thought insertion and no thought broadcasting. In the orientation and cognitive, patient was well oriented to time, place, and persons. For attention and concentration, he had poor attention, which is we not able to do the serious subtraction or the 100 minus 7 in less than 2 minutes. For the memory, his immediate memory was intact and able to do digits span test for 5 digit forward and 4 digit backwards. For the recent memory, patient was able to remember 4 out the 5 object that was told earlier. For the long-term memory, patient was able to tell his
How
identification.
long did you test the patient after for that recall test? How long?
For 5 minutes.
5 minutes. How many objects did you test?
The object, betul?
Berapa item you test the patient?
5 item.
5 item, 5 minute recall.
Yes.
Okay.
The patient only remember 4 out of 5.
Okay. Okay.
Okay. The memory is intact and yes, the memory is intact.
Okay.
For the information and intelligence, for the comprehension, he was able to comprehend well and understand the instruction. For the general knowledge, he was able to name 5 states in Malaysia and was able to name the capital city of Malaysia. And for the arithmetic, he was able to solve the arithmetic problem given to him. And for the vocabulary, he knew the meaning of the word perpustakaan. So the information intelligence was in text. For the abstract thinking, in the proverb, patient was able to give the meaning of proverb, which is like bagai anjing dan kucing. And for the test of similarity, patient was able to give the similarity between apples and orange and said both of them is fruits. For the test of different, patient was able to give the difference between airplane and bird, and which is bird is the a live object and airplane is a non-live object. And you had abstract thinking. So for the judgment, he know it was wrong for the social judgment.
Mhm.
For the test judgment, to say that when he see a house burning fire, he would call 999, and he know that it's wrong to hit people without ribbon. And for personal judgment, he would like to continue his study and to make music in the future. For the insight, he know that the symptom he had is due to his illness, and that he suffer. Patient is aware that he had a mental illness and seek for the treatment.
Hmm.
Okay,
So,
doctor,
what insight that he has?
a good insight.
Good insight. Which level? Emotional or intellectual?
Intellectual.
Why you say it's intellectual?
Because he seeks for the treatments.
Okay. Okay. Does he understand what's wrong with him?
Yes, he understand that he had wrong with him.
Okay. So, based on your history and MSE, any physical examination that you have done?
I think I should done some thyroid examinations.
Okay. He is a man then.
Yes.
Anything that you can observe?
Observe enlargement of the thyroid and
Is
observe
there
if there's
is there
any.
any
Oh, no enlargement of thyroid.
lagi?
Uh,
What else?
yes, itu.
What else that you would like to find? What
Uh, if he had sweating presented,
okay. What else?
and also I can check his heartbeat if the
Okay.
strong heartbeat.
Okay. Apart from that, what else?
Apart from
Oh, kawan you ada ke tu bercakap kat belakang tu? Cakap dia diam lah sikit. Oh, ada kelas ni.
Diam sikit aku dah kelas. Sekejap, Prof. Okay.
Okay, now, what else?
What else?
Appearance?
Oh, for the appearance,
During COVID, you boleh nampak apa? Mata dia macam mana? What sign that you would like to elicit if you want to exclude thyroid?
if I want to exclude that, I will elicit the hypothalamus.
Hypothalamus, okay?
Okay.
So, you couldn't find anything.
Yes.
What the whiter sign? The mistake dekat student bila dapat case psychiatric, dia tak examine the whiter sign and also physical examination. What about the whiter sign? Have you checked the BP? Sorry?
No.
Okay. No? Okay, in the whiter sign, what you want to look for?
The sign, I want to look for his pulse rate.
Pass rate, okay. Why?
It could be due to hypothyroidism, which increases cardiac output.
Okay, good. Okay, now, what else in the vital sign that you would like to elicit?
Uh,
Vital
wait,
sign, physical examination, sorry.
to see if there any weight loss,
Weight loss, why?
also to rule out hypothyroidism.
Okay, apart from other hypothyroidism, what else? What you want to find out from physical examination?
So what else? Anxiety.
Hmm?
Shortness of breath.
Shortness of breath, lagi?
So I can rule out panic attack, dizziness also.
Lagi?
Hmm.
Physical examination, physical appearance.
Physical appearance. Physical appearance.
Anapelo?
No, no.
Okay, why?
Fellow can rule out
Hmm?
fellow to rule out I don't know what else.
Anemia.
Anemia.
If patient anemia, how they can be presented?
Patient anemia, it can present usually with pallor, fatigues.
Fatigues, what else?
Mm, what?
What the patient has?
Poor, poor hand, poor perfusion,
For perfusion, what else? Palpitation.
palpitation.
Then, okay,
Right.
now, based on your mental history, mental status examination, physical examination, you have ruled out there's nothing. What is your diagnosis?
I was my diagnosis the social anxiety disorder.
Social anxiety disorder. Why social anxiety disorder?
Because he has fear in the social situations,
Mm-hmm.
and also the present of social situation will make him have having anxiety.
Mm-hmm.
That's for criteria C for the and also it's for the criteria D more than 6 months.
Okay.
And for the criteria probably if the it's what it's impair his social social and social and impairment and cognitive impairment.
Cognitive impairment? What do you mean cognitive impairment?
Cognitive and mental state. No, it's social only.
Social and occupational functioning.
Occupational, yes, occupational.
Okay, what is the occupational that he has?
He's a student, so
Student. Impact the studying kan. Dia
yes.
macam you all semua ni lah. Yang lain ni tutup video ada social anxiety. Okay, now what your differential diagnosis?
My differentialities is the SAD secondary to the hypothyroidism.
What is it? Social anxiety due to hypothyroidism. You already exclude. There is none.
Okay, yes.
What else?
Uh,
Functional disorder.
Functional disorder could be general anxiety disorder.
Okay. Why you exclude general anxiety disorder in this case?
There is no free floating anxiety.
What do you mean by free floating anxiety?
Mm, the thought was the, 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 the thought was presented even though it's not trigger event.
Which one? In your case or what?
Uh, the thought was presented which even though there's no triggering event in my case. That's why I ruled out GAD.
Kalau JAD sepatutnya?
Patutnya dia benda tu
What happened in your case? The anxiety occur when?
occur when in the social event.
Okay, what about JAD?
Is it JD present with the triggering event?
Is it a great event? Are you sure?
No. There's no trigger to the JD.
Okay, then what happened in JAD then?
Hmm. The thought was persistence
The
all
thought
the
was
time.
persistent. Lagi? Only the thought?
And the anxiety,
What do you mean by anxiety?
the symptom of the anxiety like irritability,
Irritability, what else?
muscle tensions,
Attention.
the criteria for the GAD symptom.
What is the criteria for JAD then?
Present of the 3 of the 6 symptom.
What is the sixth symptom?
Muscle tensions,
Okay,
irri-
muscle tension,
irritability,
irritability.
restlessness,
Mm-hmm.
difficulty to sleep,
Mm-hmm.
and 2 more. Palpitations
Palpitation.
and
And how this symptom presented as compared to your case? Kalau in JAD.
in GAD, this symptom present it's almost similar, but not in the social situations.
So, what time? Is it most of the time? Or episodic nature?
Could be in the episodic nature.
You mengarut lah, you ahli. Okay, then what are the differential diagnosis?
Other differences could be to the PTSD.
PTSD. Okay, tell me, how you said that this could be PTSD?
If there is present of the traumatic event throughout
Is there any traumatic event here?
for the traumatic event was there, but it was not very close to the when the symptom is presented.
What is the traumatic event in this case?
Probably when he in August he first entered university for the first time.
Is it traumatic?
Probably for him because he meet new people, unfamiliar faces.
Is it traumatic if you meet
Oh,
new people?
No.
Okay. What are the differential diagnosis that most suitable rather than PTSD?
Panic disorder.
Okay, panic disorder. How is the panic disorder become your differential diagnosis?
Panic disorder is
Hmm?
when present of the panic attacks.
Okay, what is the panic attack? Can you tell me what is the panic attack?
Panic attack is the present of the symptom
Symptom of what?
symptom of the 13 symptom in the criteria A.
Apa benda? Jangan sebut criteria A. I don't interested about criteria A, but what is the symptom?
In at least present of the 4 of the 13 symptom,
What is that
which is
in
could be
your patient?
in my patient it present with two symptom, which is sweating and palpitations
Okay,
and
what
fever.
else?
If panic, it could be shortness of breath, dizziness,
Okay.
nausea,
Mm-hmm.
fear of dying.
Okay. Does patient have that symptom?
No, he only have 3 out of 13,
What is the three?
which is sweating, palpitation, and
How do you differentiate social anxiety with panic disorder then?
so pain disorder usually triggered in the less time,
What
usually
do you mean?
between 30 minutes to 1 hour.
So in social anxiety,
It depends on the triggering event.
so in panic there is no event.
So event lah. panic also has event.
Hmm?
Uh,
How you diagnose panic disorder?
Ada diagnosed panic disorder with if the present of the panic attack.
Panic attack. Okay. Repeated panic attack.
Yes,
Recurrent
repeated
panic attack.
panic attack.
Okay. Can you tell me what is the criteria for panic attack?
Okay, the first of all is present of the 4 out of the 13 symptom. And for the second criteria is the present of the panic attack for 1 month with at least thought of the consequences, like if patient has been palpitation, he thought of having a heart attack.
Hmm?
And
Okay. Yes. How is the nature of panic attack to compare to social anxiety attack in your case?
if it, he have a maladaptive change when he has a panic attack, maladaptive change in behavior.
For example?
He avoid to do such a situation that he
He,
would think to have a panic attack.
he avoid such situation. In your case, he also avoiding.
Or to
Then pass. How do you manage the case then?
for the investigation tu,
Management of the case. Okay.
I would do mini spin test, social phobia inventory,
Okay. Straight away do that or what?
and also if you want to rule out hyperterrorism, we can do thyroid function test again.
Lagi?
Uh, if also want to rule out substance, what tu?
Okay. Tadi tak ada pun dari differential diagnosis you substance.
Could be in the differential diagnosis.
Hmm? What else? What investigation that you would like to do?
Psychosocial,
What's psychosocial?
psychosocial issues.
Boleh. How do you manage the case then?
Uh, if
Doctor, right? You have to manage the case. So how are you going to manage the case?
if for treatment, I would only
Hmm?
the treatment tu.
Okay, treatment macam mana? Have you did enough investigation?
For not yet, I think.
Not yet. Then what you want to do then?
Mini,
Hmm?
if I want to rule out,
You want to rule out what?
if I want to rule out PTSD, I would ask his
Okay, time's
mother.
up. Time's up. You tak sempat pun sampai nak treat kan? So, dah bunyi dah. Setengah jam dah up. Okay. Semua orang lain. Can you comment Alif punya performance? Alif ni Alif apa eh? Alif
Syafiq.
Farhad satu lagi kan? Alif
Syafiq.
ha? Alif Syafiq kan? Okay. So performance comment Alif Farhad kembar nama Alif kembar Alif. What do you think? How Alif Syafiq present performance? Rasa macam mana? Ha? Apa? You roommate ke? Tak roommate eh?
Tak. Tak dengar.
Tak dengar lah Alif.
Dengar ke?
dengar.
Sekarang.
So maybe I think dia punya strength and dia punya weakness. So something that we can improve, maybe be more confident.
Ha?
Be more
You rasa
confident.
dia rasa okey
Tapi
ke tak? History dia okey tak?
from the history, I think he did good.
You rasa history is good.
Semua
You
kalau
make,
mungkin part management,
okay, tak apa.
kalau
Kita itu
mungkin
history dulu, Alif. Can you make a diagnosis based on Alif Syafiq punya history?
from his history, actually I want to ask macam a few question macam untuk differential lah juga. But when he said that patient had this fear in social situation, maybe one of the thing that I want to rule out is maybe agoraphobia. So maybe we need to maybe Alif Alif juga kena maybe tanya if patient had any difficulty using the public transport ke, if it's been in an open space macam kat parking lot or in a closed space macam
Alif did say
cinema.
that. Alif, did you say that? Did you mention?
I don't mention in the history book of Radiant.
Okay. So, we cannot exclude agoraphobia from the history, right?
Yes.
Okay. Okay, thank you, Alif. Ini pergi pada Afifah. Afifah, you okay ke sekarang? You boleh join?
Boleh, Prof.
Okay. From the history, can you make any differential diagnosis?
From the history, actually Alif macam tak letak more kepada untuk exclude GAD tu. Sebab dia just mention pasal social je, tapi dia tak tanya patient macam ada daily activity dia, pasal family dia ke, pasal study dia ke apa. So susah nak
Okay.
exclude GAD kat situ lah. So
Susah nak exclude
tanya,
GAD.
sebab kena tanya lebih detail pasal dia punya daily activity.
Okay. What else? Amiro, can you exclude other differential diagnosis tak? In the history. Panas saya kat hostel. Semua pasal kipas. Boleh Amiro. Okay. So tak ada substance use. Okay. Okay, what else? Okay. Okay, can we exclude panic disorder? Bushra. Bushra, are you following? Kesian roommate Amiro. Can we exclude panic disorder in Alif history?
I think we can exclude panic disorder because he already mentioned about the symptoms. The patient only have 3 symptoms, but for panic we need 4, at least 4. But I also want to ask one more question, whether the anxiety state, is there any search of the anxiety? Because
Yes,
in
the nature of anxiety itself was not clear. Okay, so you have to differentiate here when he has anxiety, but Alif repeating occur the anxiety. What nature of the anxiety? How is the anxiety was experienced? Is it experienced within increase the peak within 5 minutes, 10 to 5 minutes, and then resolve spontaneously? Or it just occur during the experience that the patient has to bear during the online class or during queuing in the supermarket whatsoever. So how is the experience? It wasn't clear there. So in panic, usually it's episodic, it occur unexpectedly. Usually, patient refuse to go out because afraid of another attack when there is no help is available, and then that comes to the Ali Farhad punya soalan pasal agoraphobia, kind of that thing, then they would actually prefer to stay at home, kind of that thing. So nampak kat situ the experience of anxiety itself was not well explained. Okay, sebab kita nak rule out the panic, you nak rule out GAD, you nak rule out tadi substance, and then you would like to rule out medical condition. Irfan, what medical condition that you would like to rule out? Walaupun Alif cakap emergency kata tak ada apa-apa. Tapi you are the one that seeing the patient in emergency. What you want to rule out?
I think we should also rule out hyperthyroidism punya cause.
Hyperthyroidism, what else?
Other than that,
Hmm.
apa lagi?
Doktor, kita tak treat you all nak jadi psychiatrist. Kita nak latih you all jadi doktor tau. You are the one that seeing patient in casualty. Yang ni yang my MO duk complain, dia kata sekarang houseman ada kerja dekat casualty, duk refer case je. Refer yang unnecessarily. Dia kata the MO ke houseman? Kadang-kadang houseman yang refer tu. Sebab yang kadang-kadang semua panggil psychiatrist. Okay, what you want to exclude? Apart from thyroid.
Can we also exclude respiratory causes because shortness of breath?
Respiratory causes such as?
Such as sorry Prof, I cannot think.
Tak boleh lah jadi doktor. Buat dah medical.
Dah.
Dah lagi lah. Apa benda? What is the dangerous causes that you have to exclude? Patient presented with you with palpitation.
Heart attack tu.
Heart attack, IHD.
Oh.
Yes, could be hypovolemic shock. Okay, what else?
Is it possible Cushing syndrome tu?
Cushing syndrome, yeah. What else?
Respiratory disorder such as asthma or COPD, doctor?
Asthma or CPD, tapi you akan nampak all that thing daripada physical examination. Okay, kan? All these things you have to exclude that one, and then should be in your HOPI. Apa yang missing in Alif punya history tadi adalah the nature of the experience itself very short, sangat scanty. Okay, what investigation has been done in casualty to rule out all the medical causes? Sebab sebelum tu barulah dia refer pada psychiatry. Anemia, hypoglycemia, okay, electrolyte imbalance, semua kan ada presented macam ni kan, dengan palpitation kind of that thing. Kan, dehydration. Betul?
Betul.
Kan, the normal causes yang presented with this symptom. And then all the investigation including what? ECG? Is ECG being done? You kena tanya your patient. Has they been excluded? ECG.
Is it necessary doctor to mention in the HOPI?
Yes, it is necessary. Because that is to show that you know what is your differential diagnosis, how you already exclude it. Okay, apart from substance. Okay, other medical condition, Jazlyn. Tadi dah sebut, Jazlyn pula. Ada one more thing. What is the chief complaint tadi?
Presenting of the market fear and sweating.
Sweating. Macam mana? Sweating and palpitation. Biasa sekali kita tak ada sweating saja kan? Sebab palpitation. What is your differential diagnosis, Jazlyn? Dah sebut dah tadi.
So differential diagnosis is started K of the lima. The K
Apa?
of
Apa benda tak dengar?
any drug related.
Drug orang dah sebut selain pada drug. Apa benda selain pada drug? Patient datang dengan sweating and palpitation and associated with fear. Sweating and palpitation, what you want to exclude?
Not sure from.
Ha? Tak sure ni jadi doktor apa ni tahun 4 dah. Medical dah habis kan? Apa? What medical condition that presented with sweating and palpitation? Go pada systemic review you lah tadi. Kita dah go pada cardiac causes. Kita go pada respiratory. What else? Endocrine tadi I dah sebut pasal hypoglycemia. Tapi ni what else? Ha? Jazlyn?
TB, pulmonary TB.
Yes. Could be pulmonary tuberculosis. Is there any fever? Okay. Lagi? Lagi? So, lagi apa lagi? It could be what? COVID? Is it COVID? COVID akan presented macam ni ke? Cepat. It presented macam mana? Selain pada what is the medical condition that can presented with sweating, palpitation?
Is it MI?
What?
Is it heart attack? MI?
Kita dah sebut tadi, selain pada tu kerti. Is there any CNS condition that can presented macam tu? CNS. Ada?
Is it stroke? Is it stroke?
Stroke presented macam tu ke? Dia young.
Yeah.
Okay. What else? What organic condition that you have to go out? You are good, Jazlyn. Could be tuberculosis infection. So patutnya you dalam your history there is negative relevant point throughout all these features. Nausea, vomiting, okay, lethargic kind of that thing. Okay. Okay, what tumor can cause anxiety? Which part of the body can produce anxiety symptom? Tumor of what?
Is it pituitary?
Pituitary tumor dia jadi macam mana, Farhad?
Kalau pituitary dia boleh ada tapi dia sweating je.
Sweating boleh. Selain ada tu? What about adrenal gland tumor? What happened to adrenal gland tumor?
Increasing cortisol.
Okay.
The pheochromocytoma in which there is increase in noradrenaline production.
Yes, very good, Hua. Okay. Pheochromocytoma. Okay. So, you have to mention everything in your HOPI. So, that is what missing. That is why you are struggling to make your differential diagnosis. Okay. Bear in mind, in long case, I'm not alone. My partner would be from medical. They will dig into this information when there is cases of anxiety. Panic disorder, social anxiety, JAD, you have to exclude this medical condition, and this medical condition you have to be very fluently in your hands. Okay? Faham? Okay, nanti dia akan tanya detail lah. I tak detail lah. Nanti dia akan tanya how you investigate pasal pleochromocytoma. How you investigate pasal dexamethasone suppression test whatsoever. Okay, so faham Kalau kita tengok tadi, HUPI stock but very scanty. And then kita tak boleh buat differential. So that is why you have to include the negative relevant point. Walaupun tak ada, tapi it's important as your differential diagnosis in your HUPI. Boleh Alif?
Oh, okay.
Okay. So then we go to your punya, because this is fresh new case, there is no past psychiatric history, and in the past medical history again, the one that you all tanya tadi, asma ke apa, kena mention. Okay. Is there any type 1 diabetic ke whatsoever? Kalau tak ada, tak adalah. Tapi just roughly mention there is no past medical history such as asthma or diabetic, type 1 diabetic kind of that thing. Sebab this patient is very young kan? Okay. So then you go to family history. Is there any family history of same disorder?
Oh, no.
Okay.
Mesti
So
ada.
then you go kepada personal history. Personal history you actually did cover that. Cumanya kalau kita nak lagi adalah how he react with the divorce and then the passing of the father kan, the biological father. Cuma kat sini, you selalu sebut family. Dia duduk dengan siapa? Mak ayah dia bercerai. So you duduk with mother or father. So kita tak clear. So perhaps you can improve that one. Okay, now go pada premorbid personality, social history, premorbid personality. Saya tengok dia kata yang lain tu you kata okay, and then you are struggling during the discussion. Okay, sebabnya the knowledge lah. Nampak your knowledge a bit weak, tak strong mana. You duk sebut je kriteria A, kita tak bother kriteria A, B, C and D. Kita nak tahu what symptom that patient has that actually fulfill, and then how is the nature of the symptom. Okay, maksudnya kalau you nak exclude panic disorder must come with panic attack, recurrent panic attack, and the nature of panic attack is episodic nature, it can unexpectedly, it reach the peak within 10 minutes, and then biasa kita akan tanya what relief it, and then usually relief by wife massaging ke whatsoever, relief by themselves ke, kind of that thing. Ataupun generalized anxiety disorder. Dia punya nature adalah dia always worried, constant worries. Tu yang you duk kata free floating worries tu apa benda? Kalau you tak faham, dia just always worry without any reason. Or even about small things. Okay? Cuma your patient, he just worry about being scrutinized, being observed in the public. That's why dia jadi SAD. So you kena tahu cara nak defend. Okay? And then you come up dengan substance. Sedangkan dalam history tak sebut substance. Kalau ada substance, then could be substance. Dan kalau you nak ambil role pasal substance, you kena tahu what substance induce this anxiety disorder. Okay? So, and then other medical condition. It could be due to other medical condition such as what we already mentioned. Sebabnya kita dah sebut dalam HUPI, then kita boleh kata okay, ada medical condition that can produce the same symptom such as yang paling teruk, yang dangerous sekali adalah MI lah kan. Ischemic heart disease, MI, lepas tu yang lain-lain, all that thing. That's what we already discussed. And then now we go pada management. Bila doktor tanya management, kita tanya diagnosis, kita tanya management. Usually kadang-kadang kita kata formulate the case. Formulate the case tu you kena tahu etiological formulation. What is predisposing, precipitating and perpetuating. Tadi saya skip sebab kita spend so much time dekat differential. You struggling with your differential. So now management. Management bila doktor kata management is start with investigation and treatment. So you have to investigate, rule out your differential. The key words for management, for investigation, nak rule out differential and confirm the diagnosis. Cumanya dalam psychiatry, kita kena rule out other thing lah. And then barulah kita confirm dia. Sebab dia by exclusion kan. Kita kena rule out anemia, kita kena rule out IHD, kita kena rule out. So your investigation list tu panjang. Daripada blood kepada non-blood, daripada non-invasive kepada invasive. Kind of that thing. Okay, kena ada ECG-nya, okay. And then lepas tu kalau my partner daripada medical, kalau lah the suspect, this is the one that, contoh you present a case of panic, dia akan tanya you, what cardiac condition that can co-occur together with panic. Siapa yang tahu soalan ni? Alia tahu tak? Jawapan. What medical condition that co-occur with panic? Kalau patient ni panic. Alia tahu tak Alia?
Medical condition.
You on kan? Saya risaulah. You punya knowledge ni kan tak banyak sangat tau. Sebab COVID ke? Sebab apa Sebab by this point, sepatutnya yang senior-senior lepas, dia orang dah mahir tau. Ini yang tanya, what is medical condition? Sebab kadang-kadang saya takut bila kita buat seminar online, you all tidur. Lepas tu you all kata nak baca lepas ni. Memang lepas ni baca tak baca lah kot. Apa medical condition? Lepas ni akan, jangan lupa lah. Apa medical condition? Cardiac condition. What cardiac condition can occur together with panic? The textbook ada.
Myocardial infarction ke?
Tak.
Bukan.
Bukan. Mana? Alia?
Tak sure lah doktor.
Siapa tahu? Cardiac condition? Tak tepat.
AFib ada. Atrial fibrillation.
AF bukan?
Acute coronary syndrome doktor?
Tak.
Prof.
WAF punya problem. What WAF? Which WAF?
Is it mitral valve prolapse?
Yes, Haziq. Very good. Mitral valve prolapse. So, it can occur together with panic disorder. So, nanti I pernah, my medical partner tanya soalan ni Sebab ni I bagi tahu you soalan-soalan yang dia tanya dalam long case. So, and then you have to know how to diagnose, how to see mitral valve prolapse. So, you akan buat echo. And then dia kata, what is the expected finding? Echo dia macam mana? How you interpret the EF, kind of that thing. Faham? Okay. So, nanti dia akan tanya banyak lagi lah. Okay. So, contoh macam tu lah. So, investigation to rule out medical condition and then daripada blood kepada non-blood, urine or whatsoever, non-invasive kepada invasive. Okay. Then only psychosocial. Tiba-tiba tadi Alif you sebut apa benda investigation you nak buat tadi? Tadi sebut apa? Investigation apa yang nak sebut?
Oh, yang mana yang first tu?
You sebut apa?
Saya sebut mini spin test.
Apa tu?
Dia social phobia inventory tu.
Ada tak orang buat?
Saya jumpa internet.
Awak jumpa internet pun. Kat klinik ada buat ke?
Tak ada.
Tak ada kan? So kind of that thing. Jangan sebut benda yang tu clinical psychology buat. Kita tak buat pun. So mungkin you akan nak buat apa yang biasa kita boleh buat. Kita akan tanya family history, trace or notes. Okay? Okay, kalau ada inventory pun setakat anxiety inventory saja. Okay?
Okay.
Boleh? Nampak sangat? Tak real kan? Okay. Kat klinik, you tengok patient kat klinik ada kita buat? Tak ada pun. Okay. Now, kita stop dengan this investigation sebab time's up. Untuk bila dalam exam, dia akan proceed dengan management, investigation and treatment. Treatment, what you kena, again, you boleh pharmacological, non-pharmacological. Okay, in this case, what pharmacological treatment that suitable. Sebab tadi tak sempat. Dia stop dekat ni, Maisarah.
Okay, so for management, first, sorry Prof, you asked for the pharmacotherapy, right?
Treatment, yes.
So for the pharmacotherapy, I will give selective SSRI, selective serotonin reuptake inhibitors, such as escitalopram.
Okay.
Then for this patient, actually, if me, I would first I would choose non-pharmacological, which is I will teach patient for breathing exercise and ask patient to do the progressive muscle relaxation. And just now in clinic, I had this one patient where she had generalized anxiety disorder, and then this MO teach her to do the negative automatic thought diary, in which she asked the patient to list down the thing that she worried, and also what is her feelings during that time, and also what's the what's the outcome of what she feels. For example, if she worried about the child, for example, because the patient in clinic just now worried about the child. So what is the outcome of worrying about the child? So it didn't bring the good outcome for the mother itself lah, because the child already adult. So why need to worry about someone who is in adulthood yang boleh control diri dia sendiri, something like that.
Very good. Cognitive automatic negative automatic thought is part of what treatment? What modality of treatment?
Masuk Prof.
What modality of treatment? Which modality of treatment? That technique tadi yang you describe.
Psychological.
Psychological, bawah dia apa? Bawah psychological lagi? What we call? Apa yang kau belajar?
Yang ada psychotherapy, psychodynamic tu ke Prof?
Yang ni apa?
This one psychodynamic.
Narut lah. This is CBT, Cognitive Behavioral Therapy.
Cognitive.
Dan negative automatic thought di bawah cognition. Cognition kan pemikiran, cognitive, and then followed with the behavioral. So dia akan improve. So yang ni mungkin kita boleh, yang diajar negative automatic thought diary itu adalah to focus on the cognition. Later on dia ajar buat breathing exercise. So in this patient, Alif, what is the paling bagus sekali? And then, sorry, Maisarah, you are very good. Okay, non-pharmacological is the number one treatment for this kind of case. Pharmacological tu later on. Biasanya kita akan approach this case dengan non-pharmacological. I nak tanya presenter, name me one non-pharmacological atau technique that is suitable to be prescribed to this patient.
Is it the relaxation?
Okay, relaxation lagi.
Relaxation breathing technique.
Relaxation lagi. Behavior treatment. Dia punya key clue behavioral.
Behavioral. Child behavior therapy.
Mengarut lah awak ni.
Bukan child. Dia apa nama?
letih Prof Azizah ajar you all. Cepat. Nak habis kelas dah. 1 jam. Hanya lepas ni bolehlah kawan-kawan you nak kacau you all. Okay. Behavioral therapy. What behavioral therapy? Siapa tu
It's
kisah kamu?
behavioral therapy.
Apa? Namakan that technique. This patient, your diagnosis adalah social anxiety disorder.
Social skill.
Social skill apa benda Alif.
Kalau role play tadi.
Role play macam mana? You nak role play dia macam mana? You nak bawa dia pergi tiru you membeli belah. Macam tu? Anybody else? Boleh bagi saya jawapan?
Dia panggil itu behavioral ke? Dia desensitization.
Very good. Systematic desensitization. Okay. Ataupun graded exposure. You grade dia sikit-sikit. Kalau tak nak sebab dia dengan anxiety, takut. So mungkin keluar sikit exposure. Graded exposure atau systematic desensitization. Okay, more dalam behavioral therapy. Okay. So nak role modeling macam mana dia kan? Dia takut, dia anxious. Dia takut orang tu dia. And dia sikit-sikit kita bagi dia cakap sikit, bagi dia ni sikit, all that thing. Okay, graded exposure. Okay. Dia, ni Prof Azizah ajar kan? Behavioral therapy kan? Betul Dia ajar kan? Dalam psychotherapy modalities. Tak tahu baik baca. Nanti ada soalan exam. Okay. So, last one, bila kita dah tanya semua ni, and then you boleh cerita supportive psychotherapy, kind of that thing. Okay. Kita akan tanya you satu soalan lain, which is maksudnya kita dah complete assessing you, adalah prognosis. What is the prognosis of this patient? Dalam masa setengah jam je tau. Okay, what is the prognosis of this patient? What do you think? Macam mana good?
Cooperative.
Kenapa you kata good?
Cooperative patient.
Cooperative lagi? What factors that supporting for good prognostic factors? Yeah, his awareness, his compliant. Okay. And then in general, anxiety disorder has a very good prognosis, provided this disorder can be cured, kan? And then there is treatment for it, and then he has good, and then he willing to work through with the treating doctor. So in general, he has a very, very good prognosis. Macam tu Alif jawab soalan.
Okay.
Okay. Okay. So, okay. So that's all for today. Any other question? Okay semua? Boleh?
Doctor, I have question.
Hmm.
How I can rule out agoraphobia in this case? Because because he have present of 2 out of 4 criteria. Yeah. So he could have agoraphobia also.
Agoraphobia dia jadi macam mana? Apa beza social anxiety dengan agoraphobia?
Itu dia punya features dia clinical.
Social anxiety dia macam mana? What is the main theme of social anxiety? Social anxiety, afraid of being humiliated, afraid of being scrutinized. Itu social anxiety. Dia takut orang scrutinize dia, takut dia dimalukan. Agoraphobia, dia afraid where there is no help is available. takut. That is the how we can differentiate between agoraphobia and social anxiety. Itu je. Bila you tanya tu, you tanya macam why he afraid of, what fear feeling that he has. And then what contribute to that fearful. Okay? Boleh?
Okay.
Okay? So walaupun dia kata, sebabnya dia dalam DSM-5 tu dia kata too overcrowded, sebenarnya dia punya agoraphobia tu dia more pada exposure tu dia macam escape is not possible, macam gitu. Dia tak boleh nak escape that situation. So because dia takut, dia tak boleh nak escape, so dia jadi agoraphobic. So itu yang ada public places tu. Social anxiety, dia boleh keluar dekat public places. Tetapi dengan syarat dia tak rasa orang pandang dia. Tapi bila orang pandang dia, orang tengok dia, tu yang lari daripada public places tu. The reasoning behind. Okay, faham tak? Orang lain faham tak? Okay, itu saja. Okay, that's all. Saya ada satu lagi kelas kan. Saya sebenarnya memang sangat tak suka kelas online. Tapi tak apalah. Cuma my advice to you all, setakat saya assess you all, this is your week 6. You all kena baca balik. Mungkin sebab online learning, sebelum tinggalkan psychiatry, sebab lepas ni memang you akan lupa. You akan masuk balik tahun 5 sekejap saja, dan this is the time that tahun 5 tak sempat nak baca balik. It's just to understand, tak payah hafal sangat Alif, kriteria A, B, C and D tu. Sebab nanti memang you tak terhafal pun. You just understand. Okay, kalau panic, you just imagine yourself being panic. Panicking macam mana? And then recurrent panic tanpa sebab. That is panic attack. And then cumanya kalau GAD, you just imagine you just worried. Most of the time tak tahu apa pun, duk worried je. Okay, kalau anxiety, social anxiety, takut nak cakap depan orang, takut orang pandai, takut buat salah. Okay. Agoraphobia, takut tak ada nak lari, tak boleh nak lari, duduk stuck kat situ. Okay. It's just to understand that situation, later on you cerita je. Okay. Sebab bila duk hafal A, B, C and D, sampai bila pun you tak boleh nak hafal. Banyak lagi benda nak hafal. Nak hafal statin punya drug lah, apa, ARB punya drug lah, whatsoever, kat medical banyak lagi, kan? So just understand, cumanya the basic thing kena faham lah. Okay, so my tips to you all semua, anxiety disorder yang you all kena baca sekarang before you left adalah panic disorder, GAD, social anxiety, OCD. Okay, yang ni yang common keluar untuk soalan. Lepas tu yang uncommon kita akan tanya you dalam SBQ gitulah, illness anxiety, PTSD tu you boleh faham sikit. Okay, PTSD pun ada soalan long case tapi jarang-jarang lah. Okay, tapi yang main thing adalah psychotic disorder, schizophrenia, MDD with psychosis, MDD without psychosis, bipolar disorder, bipolar 1, bipolar 2. Yang ni a must. Sebelum keluar psychiatry ni, make sure you baca yang ni, you understand this one. Sebab yang ni adalah common illnesses yang selalu tanya, yang selalu keluar dalam long case. Okay, boleh? Okay, that's all. Okay. Okay, tak ada apa-apa soalan kan? Take care everyone.
Thank you, Prof.
Okay.
Okay,
Prof.
take care, bro.
Okay, salam kat roommate tu. Mana-mana roommate.
Okay.